According to what I've been hearing and reading, up to 25% of people with multiple sclerosis have a diminished, altered, or totally absent sense of taste. Are you one of them? Have you told your doctor? And what did they say? Hello, and welcome to another episode of You and Me and Multiple Sclerosis. My name is Pam. I've been living with multiple sclerosis for almost 40 years. Well, sometime in the first 10 or so years of my having multiple sclerosis, I experienced a few weeks, maybe a couple of months even, where I suddenly lost the ability to taste things the way I normally would have. Everything tasted really awful. A lot of it tasted like metal. Some of it even tasted like blood. It was really hard to find something decent to eat. Well, I happened to be eating breakfast, or trying to, at the International House of Pancakes in the University District of Seattle, Washington, when I discovered that I could actually enjoy eating potato pancakes with applesauce. Well, that's hardly a balanced diet, but at least I could eat it and it tasted fairly decent. After a month or so, my taste buds returned to normal, but I know that there are people with multiple sclerosis for whom that is not true. Their senses might somewhat return to normal, but they realize that they have lost some of the sense of taste that they used to have. So when I saw a recent MS selfie with Dr. Gavin Giovannoni, or Professor G as he likes to be known, that talked about the loss of sense of taste, I was very interested to see what he had to say. And after I listened to his podcast, I went out on the internet to see what else I might be able to find. Other papers, other articles, other podcasts, clinical trials, anything. And what I found, kind of surprisingly, was that there really wasn't much out there. And I thought to myself, well, that's kind of strange for something that affects 25% of the people who have multiple sclerosis. You would think there'd be more information that's available. But be that as it may, I decided I would go ahead and compile what I did find and share it with you so that at least you're as well informed as I am on the subject. Most of it you might know already or have figured out on your own, but I figure it's worth sharing just in case. So let's go ahead and see what I found. I found this article on my MS Team website. It's called MS and Loss of Taste, 5 Things to Know. And it was published on May 22nd of 2023, so it's not very old, and probably the information hasn't changed a lot since then. At least that's what I'm going to assume. The article begins with a couple of examples. One person says, MS has my sense of taste wacky at times. Clean cup, fresh coffee, and my first sip tasted like pesto today, one my MS team member shared. Has anyone had MS take their ability to taste? Another asked. Everything tastes the same. These 2 members of my MS team are among the 25% of people with multiple sclerosis who experience loss or changes in their sense of taste. Losing your sense of taste, known medically as ageusia, noticing changes in the way food tastes, can interfere with the enjoyment of eating. This can be followed by reduced appetite, low energy, and weight loss. Many people who lose their sense of taste also have a reduced ability to smell, because those two are very, very linked, and I think you know that. When you have a cold, food doesn't taste the same. You can't even smell it, so half the enjoyment is gone right there. They say there are simple practices you can do to enhance your tasting abilities and make the most of your palate. These include exploring spices and a variety of food textures, taking time to smell your meal before eating, and chewing slowly while letting the food move around to different parts of your tongue. You can also ask your doctor or a registered dietitian for help with menu planning and tips to help you enjoy your food more. However, a loss of the sense of taste can also be caused by MS flares, another health condition, or medication side effects, so it's best to monitor any changes and share them with your doctor. Read on for 5 important things to know about losing your sense of taste with MS. And these I found fairly helpful, so we'll go ahead and take a look at them. Number 1, MS brain lesions may cause changes in taste. I found this very interesting. I wish they'd gone into more detail, but this is what they say. While many people with MS experience changes in their ability to taste and smell different foods, there isn't much research available that explains why. One study at the University of Pennsylvania asked 73 participants with MS to distinguish between substances with different kinds of taste. They have here 4 tastes, and nowadays we think of 5, but the ones they have here are sodium chloride or a salty taste, sucrose or a sweet taste, citric acid or a sour taste, and caffeine or a bitter taste. They also have another one that they call umami. It's kind of difficult to describe, but it's kind of on the savory side. But these 4 are the ones that the study looked at. The researchers found that identifying these tastes was difficult for the participants with MS when compared with another group that did not have MS. In this study, salt was the most difficult for people with MS to taste, followed by sweet. Now that is interesting to me because what it's saying is that you may not even realize that your sense of taste is diminished compared to other people or to even how it used to be, depending on how severe the deficiency becomes. So I'm curious to know, is that true for you? Do you find that certain kinds of food just don't seem to have the same kind of taste that other people say it has or that you used to think it had? The results, they say, showed that loss of taste correlates to the size of MS lesions and having a higher number of lesions. The researchers suggested that MS lesions affecting specific parts of the brain may interfere with relaying sensory information for taste. I would agree that that's probably true. I've certainly had a fair number of lesions over my lifetime of MS, but I only had the taste reduction for a very short period of time, and then I recovered, and as far as I know, I'm back to how I used to be, I think. Sometimes our memories can play tricks on us. Maybe I used to taste things differently than I do now, but it doesn't strike me that way. So I'm not sure what to make of that, but I do think they're onto something. I think that the position of the lesions, it's intuitive that that would make a difference in your ability to taste because the brain receptors for taste connect right with the receptors in the tongue. And I would think that that would make a big difference in how you can taste things. Number 2, some MS medications can affect taste. Some disease-modifying therapies, or DMTs, for MS can cause side effects that affect the mouth, gums, and tongue. Several of these can cause symptoms like distorted sense of taste, mouth or tongue sores, and oral pain. DMTs associated with mouth problems include, but of course are not limited to, alemtuzumab or Lemtrada, mouth pain, dysgeusia, which is a strange taste in your mouth, and cold sores. Glatiramer or acetate or Copaxone, which I used to be on, cavities, difficulty swallowing, dry mouth, bleeding gums, and mouth sores. I can't honestly say I ever noticed that I had more of that when I was on Copaxone. Interferon beta 1A or Avonex, toothaches, Mitox syndrome, oral mucositis or inflamed tissue that leads to mouth sores and pain, natalizumab or Tysabri, cavities, and teriflunomide or Aubagio, toothaches and dysgeusia. Other medications used to treat MS symptoms also can affect the mouth. These include amantadine or Simitrel, which I'm on right now, dry mouth, difficulty swallowing. I have not noticed that, so it's not universal. Once again, medicines affect people differently, and at least on the dose I'm on, I have not noticed that. Amitriptyline or Elavil, dry mouth, and baclofen, dry mouth and dysgeusia. Corticosteroids used to treat an MS flare can increase the risk of oral fungal infections. This is especially true at higher doses and if steroids are taken over a long period of time. And again, results are going to be pretty individual. Number 3, loss of taste can worsen other MS symptoms. If you're experiencing a taste deficit or mouth ulcers, you might not feel like eating. Over time, skipping meals due to discomfort or because food tastes bland can lead to unhealthy weight loss or malnutrition. Not getting enough calories or eating a poor diet can worsen MS symptoms like fatigue or muscle weakness. Eating a balanced diet is always to be recommended for those with MS. If you don't want to eat because of oral symptoms or you're losing weight without meaning to, it's time to talk to your doctor. Number 4, other conditions and medications can cause loss of taste. If you're experiencing loss of taste, it might not be caused by MS, and that's an important point. Just because something happens while you know you have MS, even during a flare, don't assume, and I often do this, and I have to learn not to, don't assume that it's your MS that's causing the problem. Many other conditions and medications can cause loss of taste, including these. COVID-19 infection or long COVID, and we've heard a lot about that. People who've gone through COVID have reported that they've lost their ability to taste and or smell, and sometimes it does not come back. The next one is infections of the gums, mouth, sinuses, salivary glands, or throat, certain antibiotics, certain heart and blood pressure medications, side effects of chemotherapy and radiation, dry mouth such as from Sjogren's syndrome, a lack of certain vitamins and minerals, gastroesophageal reflux disease or GERD. That definitely can play a role in how well you can taste things. Other neurological disorders such as Parkinson's disease or Alzheimer's disease. Metabolic conditions like type 2 diabetes, hypothyroidism, or kidney disease, or dentures that cover the soft palate in the mouth. It all makes sense, doesn't it? Smoking can also reduce your sensation of taste. Studies have shown that quitting smoking, in addition to being helpful for MS symptoms, can restore many people's sense of taste within a few months. And we've said this many times, there's no good reason to keep smoking. If you're smoking, it's bad not just for your MS, but it's bad for you in general. So find whatever way it works for you, but do quit, because your life will be much better. And maybe your sense of taste will be better as well. Number 5, changes in taste may signal an MS flare or a serious condition. If you're concerned that your sense of taste is not as strong as it once was, it might be time to talk to your doctor. One member of my MS team described a relapse that affected their taste buds. I've had an attack which half affected my taste buds. Everything tasted bland, like nothing. If losing your sense of taste comes on suddenly, you should speak to your doctor right away, since it could be a sign of a relapse. It's also time to see your doctor if one of the following: you're experiencing weight loss without trying to lose weight, you simply don't feel like eating anymore, you feel weak or fatigued, or you have fevers and night sweats. I think most of us with MS probably could plead guilty to at least one of those, at least sometimes. So while I don't think it's worth panicking over, at the same time, it's definitely something you'd want to see your doctor about, especially if it lasts and lasts, or if it comes out of nowhere. Like before you weren't having the problem, now all of a sudden you are. It's always good to let your doctor know. Sometimes unintended weight loss can be a sign of something serious, so it's important not to delay discussing it with your doctor. Next, I've excerpted some of an episode from Ask an MS Expert, featuring host John Strum and his guest Susan Barker, who is a speech therapist. She has some interesting things to say.
Well, let's talk about what people can do to preserve or even improve their sense of taste. Are there medical treatments that can help changes in taste?
There's some vitamin supplements out there, but you really want to check with your physician before you start taking those, and make sure they're not going to interfere with anything you're taking already. I don't typically just say like which vitamins to take right offhand, because I want everybody to check with their physician before they start adding a lot of vitamin supplements to their foods. But seasoning is fantastic. It doesn't hurt anything to add, like I mentioned, Mrs. Dash, things like that. If you like spicy, it's fantastic to add spices to your foods. If you start to taste that metallic taste, some people do, I recommend switching to plastic silverware. because your silverware could be a culprit because you're going to taste that metallic silverware quickly.
Are there things that are known to affect taste that people should avoid?
Your biggest culprit, like I mentioned, is if you're dehydrated. Those medications, those type of things, but you can't avoid your medications for MS. There are some things out there like there's the dry Biotine. You'll see it a lot out there, and it's a gel and a mouthwash. And a lot of times if you use that, it will rehydrate you and your taste will get much better. But if you can do the sweet and the salty and things like that, it will bring in that sour to your mouth, and it will help re-energize your taste buds.
What health problems might people experience as a result of alterations in their sense of taste, and how can they best be managed?
You could end up with failure to thrive, not wanting to eat because you're not hungry because you can't taste. So with that weight loss, you could end up with diabetes and things like that because you're eating the wrong things because you can't taste them. So you might taste that, sweet, things like that, where you can't taste the salty. So you're kind of migrating towards the things you can taste versus the things you can't taste. So it's very important to still try to eat those balanced meals to stay healthy. So talk to your physician, talk to your dietitian. Keep eating what you should eat, even though it's difficult because it doesn't taste well. And be open, when things don't taste well and they start to taste off, talk to somebody so that you can still get those things in so that, you're not stopping eating or you're not eating the wrong things, because you've got to eat to keep your nutrition up so that you can, work through, what's going on and stay healthy and stay strong.
Well, I think one of our viewers, Becky, is looking at the best way to do it. She wants to know if her MS specialist can help her manage a recent loss of taste, and she wonders whether it's helpful to also be working with a nutritionist to manage this loss of taste.
Absolutely. To help her balance what to eat. My background, kind of how I mentioned, is I'm a speech pathologist. So I helped, my patients that were having trouble getting their food in and down. And I work a lot with nutritionists and dietitians to help my patients, know how much to have on their plate and make sure they're getting enough in. They help know, okay, I'm not hungry. I don't want to eat a massive amount. I'm tired. It doesn't taste great. They help you know how to bulk it up. So your nutritionist helps you. Let's do a protein shake and then a meal of this much. Let's add this to this and this to that. So a nutritionist is a fantastic resource to have.
You actually mentioned dry mouth a few times during our conversation, and I did want to circle back. I'm hoping you can share some strategies. I know you've already started to answer this question, but maybe share some strategies to best manage dry mouth. Are there medications that might help treat dry mouth?
I know that there are some medications out there, and if you need a medication, I'm right there. I will tell you, reach out to your physician for a medication. The best things you can do is clean your mouth 3 times a day, and that would be brushing your teeth, your tongue, the roof of your mouth, under your tongue. This comes from my almost 20 years of being a speech pathologist. Scraping your tongue. And anyone can do that without going to the doctor. And then cleaning your toothbrush in a small cup with a solution of hydrogen peroxide and water. Do not put that hydrogen peroxide and water in your mouth because your toothbrush has to be clean before you use it the next time. So you're not putting that bacteria back in your mouth. But it's fine to brush your teeth with your regular toothpaste. But it's very important to clean that toothbrush in between and then rinse it under water. And then that will help make sure your mouth is free of all that bacteria the next time you brush. And then I mentioned those dry mouth products. One product they sell at all drugstores is Biotine, and right next to it they have the Walgreens brand, the Dollar General brand of that same thing that will be right there next to it. It's called Dry Mouth, and they have mouthwash, they have a gel, they have a spray. You can carry it in your pocket or your purse. And that stuff is, people will tell you, is magical. You put it in your mouth and you will feel fantastic. And you just spray it in there and slowly your mouth will just feel great. And that is my free advice on how to take care of your own dry mouth without having to add medication to your toolbox.
Well, you've shared a lot of really helpful insights about taste and MS. What would you say are the top 3 takeaways that you'd like our audience to remember?
Obviously, clean your mouth. That will help a lot. Season your foods and know what medications you're taking. Just read the little pamphlet so you know if they're supposed to cause you issues, so you can keep kind of a little bit of some notes so you can let your physician know. But definitely in the long run, as long as you season your foods, eat, keep your mouth clean.
Well, thank you for sharing your expertise on this topic, Susan. Sebastian wrote in asking if vitamin D complex supplements could help with loss of taste.
There are some vitamins out there that do help with the loss of taste. It was not vitamin B though. And that's kind of when I said reach out to your physicians, because there are some vitamins that I have seen that help, but it was not vitamin B.
And now finally, I will play excerpts from the podcast from Dr. Giovannoni that I originally saw that got me interested in this topic and exploring it further. Since this is a podcast, what we have is a transcript. So what I will try to do, since he doesn't go word for word here, is highlight a word here and there just so you can stay on track.
MS can affect taste. It's quite uncommon to see it as a dominant feature of a relapse, but it's not that rare. I have seen it happen in a few of my patients, over the last 30 years that I've been in the field of multiple sclerosis. What is really interesting is I got this question literally the day after I read a review article that came out in last week's New England Journal of Medicine on taste. And the interesting thing about that review article is it shows you that taste is much, much more complicated than simply tasting flavorants in food, for example. The receptors that are used for taste have a much more complicated story in our biology. And if you're interested in the evolution of taste and the role that taste plays, particularly in metabolism, I'd urge you to read the article. Anyway, it's important to understand that taste is one of our senses, hasn't been that well studied in MS. There's very few detailed studies. And so the message I want to take away is that altered taste function is possibly a hidden symptom of MS, because a lot of people with the disease may not be aware of this, and it would need to be tested to discover it. So the kind of symptoms people would have is dysgeusia, is the term we use in medicine, is an altered taste. And this gives you an unpleasant taste in the mouth. It could be a metallic, bitter, or salty flavor. That's the most common symptom, is when you have alterations in taste. So certain foods, for example, don't taste the way they used to taste. The other one is hypergeusia. In other words, your taste threshold is lower, so you just food tastes bland. You can still taste it, but it's bland. And the much rarer one is ageusia, where you lack taste completely. And this very rarely occurs in people with multiple sclerosis. But if you do have ageusia, loss of taste, it's very difficult to enjoy food. And, this leads to people not eating properly because they just don't enjoy food. I have seen one case. It was part of a brainstem relapse. They had other problems, and the taste did reverse. And although her taste recovered, I have no idea if it got back to normal. I suspect she may have had hypergeusia after that. Anyway, it does have implications for nutritional intake. Changes in taste perception will lead to a decreased appetite. You may have avoid certain foods, and you will have difficulty enjoying meals. And it's very interesting that people who have altered taste will make poor dietary choices. They may eat the wrong food because they don't like healthy foods, for example, and because they're not eating as regularly, they may have nutritional deficiencies. You may be interested to know that the GLP-1 agonists, this new group of drugs that work on the GLP-1 receptor, you may know the big one called semaglutide. It's the trade names of Ozempic or Wegovy. They modulate taste perception via the taste receptors, and that's possibly how they work, is they reduce your ability to taste food. You don't enjoy food as much, so you eat less. And this is part of their mode of action in causing weight loss. Anyway, the MS lesions that can affect taste are usually along what I would call the sensory pathway from the brainstem through the thalamus into the cerebral cortex and involve the gustatory perception. So this is an area around the insular cortex, which is a more primitive part of our brain. So lesions in this pathway are being linked to altered taste. Please be aware that if you have altered taste, don't just assume it's MS. This is one of the problems we always have. Any new symptoms always MS related. Altered taste can be caused by other things, for example, infections, particularly respiratory, sinus, or upper respiratory tract infections, can affect the taste buds and distort your taste perception. And this is particularly prominent in SARS-CoV-2 and the COVID-19 pandemic. The virus actually infected the taste buds, and they caused massive loss of taste. People thought it was also loss of smell. It affected also the olfaction, but also taste. And those two sensory symptoms are very closely related to each other and integrate. So involvement of smell affects taste, and involvement of taste affects smell, because the percept integrates the two sensory inputs. Then certain medications, antibiotics, antihistamines, chemotherapeutic drugs, certain drugs used in psychiatry like lithium can affect taste. A lot of people, when they have high-dose intravenous steroids, develop a metallic taste in their mouth. That's the effect of the drug on taste bud function, for example. Obviously, people with oral hygiene, dental issues, gum disease, dental infection, or injuries to the mouth can affect taste. If anybody's ever had an infected tooth or an abscess or gum disease, they may have this terrible taste in the mouth, and that's due to the bacterial production, the products in the mouth. Other neurological conditions apart from MS, so people with Bell's palsy, it affects the nerve, the so-called chordae tympani nerve that transmits taste from the tongue. Parkinson's disease as well, chemical exposures, loss of different chemicals and environmental toxins of taste, and also some nutritional deficiencies. Zinc deficiency, vitamin B12 and folate also can lead to abnormalities in taste. And then people who smoke, we know that they have reduced ability to perceive flavors because there's possibly the nicotine, but there are other substances in tobacco smoke that affect the functioning of the chemoreceptors that perceive taste. So I think identifying underlying cause of your taste is important for determining the treatment and management strategies. And I suspect if you have MS and you already have a threshold issue, you're much more likely to develop alterations in taste when you get exposed to these other factors. So it's kind of like an additive or a synergistic effect. But anyway, if you have altered taste, don't assume it's MS. You need to seek medical advice if it is. Now, managing taste disturbances in MS can be challenging, particularly if you're not eating properly. If your loss of taste, for example, is quite sudden in onset and due to a relapse, you may benefit from high-dose steroids. But if the reduced or altered taste persists, possibly as a part of advancing or smoldering MS, then you may want to try experimenting with flavors by adding different seasoning, herbs and spices to enhance the flavors of the food. Sometimes changing the texture of the food, making it creamy or crunchy elements into that also improves the palatability of food, even though it may not change the taste of the food. And if you can't get on top of your taste symptoms, you may need to be referred to a dietitian. You may have to see an oral medicine expert to help with this. I think dietitians are important because they can develop a personalized diet plan for you to try and meet at least your nutritional needs, despite taste disturbances. I have a few patients, they just don't enjoy food, and so they consume far too little in terms of calories and have become quite malnourished as a result. These people really do need to be sent to a dietitian to try and improve the palatability of the diet they've been offered.
Okay then, now you know everything I know about the loss of taste and multiple sclerosis, and also the pitfalls we might fall into if we blame our multiple sclerosis when there might actually be some other cause, which means there might be something we could even do about it. So now hopefully you're more well informed. But that's all I have for you today. So until my next video, please do take really good care of yourself. I'll see you again soon.